Let's talk about another important question which definitely can come in exam, and it is a repeatedly asked question regarding the inclusion bodies. Okay, so guys, from your second year up till in the NEET PG, why the inclusion bodies is coming in every exam, in the prof exam also, in the NEET PG also, because they are important. Important why? Because the viruses you can't see by the normal microscope. You need what? Electron microscope for them. Electron microscope comes in crores. So inclusion bodies, they are our tool to identify the various viral infections without much cost involved. Why? What are inclusion bodies actually? They are replicating aggregates of the virus. Okay, replicating, you know now the viruses, they replicate either in the nucleus or either in the cytoplasm. Okay, most of the DNA viruses replicate where, guys? In the nucleus, except a few. Which one? Pox virus, POXViridae family, which is there, they replicate in the cytoplasm, and that's why they produce what? Intracytoplasmic inclusion bodies. Which family? POXViridae. Similarly, regarding the RNA viruses, they replicate in the cytoplasm, and what they produce mostly? Intracytoplasmic inclusion bodies. But again, there are also some exceptions like HIV and influenza. They are mostly intranuclear. Now, a number of important inclusion bodies, they are being asked in the exam, and some of them we'll discuss. One is intracytoplasmic inclusion bodies, that is termed as Negri bodies. And the Negri bodies are seen in which particular disease? That is rabies. Okay? Rabies virus infection or rabies disease is having what? Negri bodies in the post-mortem diagnosis. Okay, post-mortem diagnosis is based on demonstration of these Negri bodies. Which method? By Seller's technique. So that is one of the points which you need to know. Then, without this Negri bodies, if you are not knowing this, then that is like you're losing your mark simply there. So Negri body is the most important thing, and this is a post-mortem finding. Intracytoplasmic eosinophilic inclusion body. Then you have guanary bodies, guys. And the guanary bodies, they are seen in vaccinia virus infection. Okay? Vaccinia virus infection. Vaccinia virus. Vaccinia virus is a pox virus. Okay? And I just told you, the POXViridae family, they produce intracytoplasmic inclusion bodies. So guanary bodies. How to remember this? Because in the exam, you tend to forget a lot of things. How to remember? You had your vaccine where? In the Goa. So guanary bodies, vaccinia. Then comes the passion bodies. And passion bodies is in the variola virus infection. And variola, for you, I'm telling up, another name for smallpox virus is variola. And how to remember it for lifetime? Remember it like this, that you have a passion to drive what in life? Ola. Okay. So which passion you have? To drive Ola in life. Okay. So that is variola. Passion bodies, variola. The fourth one is Bollinger bodies. Bollinger bodies is foulpox virus infection. We'll have the Bollinger bodies. How to remember? We should not speak what? Foul bullying. Okay? Foul language you should not speak. And that is Bollinger bodies. HP bodies. HP stands for Henderson-Peterson, which are also termed as molluscum bodies. And this particular one is observed in what? Molluscum contagiosum. It is being observed in what, guys? Molluscum contagiosum. Okay? The disease and the virus name is also same, molluscum contagiosum, pinkish to pearly white umbilicated nodule. So these five, they are the most important intracytoplasmic inclusion bodies. Is it fine?